All right, so we know that posterior instability is uncommon. There's a full spectrum of pathology. And a floating posterior IGHL, which is the combination of a labral tear with the Hagel lesion, is really rare, occurs about 4% of the time. And posterior Hagels alone are very rare too, so you have to heighten suspicion and make sure you look for all the associated pathology. So this is our case, a 15-year-old high school football player, 1 month of symptoms. His exam finds are consistent with posterior instability. This is his MRI. He has a posterior labral tear, he has a posterior Hagel, he has extension to a slap tear, and some extension to anterior labral tear as well. So here's our pre-op plan. We're going to use 4 portals. I'll demonstrate that for you. 30 and 70 degree scopes are useful. For the labral tear, I like knotless fixation. The Hagel repair, I like the standard suture anchor fixation. And then we have to make sure we have a repair sequence in a case like this. So this is our case. EUA demonstrates 2+ posterior instability. We like lateral cubous positioning. These are 4 portal sites. Posterior portal is slightly higher to be able to drill on the posterior glenoid. The posterior inferior portal is useful for the Hagel repair, and then we have a percutaneous portal for use for a slap repair in our standard anterior portal as well. So this is a diagnostic scope demonstrating a pretty severe injury from the 3 o'clock position anteriorly, going up superiorly into the superior labrum, and then down the posteriorly to the 7 o'clock position. That is our Hagel lesion right there with the capsular avulsion off to the posterior humeral insertion site in a chondral loose body. So this is us making our anterior portal. We want to make sure that we have appropriate trajectory to work and elevate the capsule and labrum as well as work on the cortical surface. We use a lasso suture passing device to pass the suture, and this is our 3 o'clock anchor going in. This is an anterior super anchor, the 1 o'clock anchor, and we're doing our slap repair. Make sure you do not overtension, so I pass point that to make sure it's not overtension.